Muted.
Good afternoon or good morning, everyone, depending on where you're calling in from. Welcome to this edition of NMAC's Community Spotlight webinar for Tuesday, May 22nd. My name is Chip Lewis. I am Director of Communications here at NMAC, and I want to thank you all for joining us today. One bit of housekeeping before we start. Some of these slides may jump ahead a little bit at first, so please don't be disoriented by that. But it may happen, so just want to give you a heads up that it might. For starters, everyone's audio has been muted by the presenter. If you'd like to ask a question, you can do so in the chat feature highlighted here. Just enter in your question into the chat box below. You can send it to either the entire webinar or to individual attendees or presenters. And once we get to the Q&A section, we will pull some of those questions out and start answering them. You can also raise your hand during the Q&A session, and we'll be able to unmute your line and take your question at that time.
Hi, everybody. So a little bit, my name is Daniel Tino. I'm the communication strategist over at NMAC. And a little bit about NMAC.
So it's my pleasure now to introduce today's presenters, and we have several of them from across the country, and we are very glad to have them all here with us today. First up is Jacob Smith-Yang, Senior Capacity Building Director of the Asian Pacific Islander Health Forum. Brian Ragas, Communications Manager of the San Francisco Community Health Center. Henry Ocampo, Senior Program Analyst, Office of Minority Health Resource Center. Jimmy Sianipar, Senior Testing Coordinator at SSG APAIT. Keiva-Lei Candena, Communications Manager at Life Foundation, and Keleka, and I apologize for mangling anybody's names, Keleka, Kaneiakala, POP Leader of Life Foundation. And we're going to start off with Jacob. So Jacob, please take it away.
Hello, my name is Jacob Smith-Yang, and I'm a longtime advocate for the HIV needs of Asian American, Native Hawaiian, and Pacific Islander communities, AA and NHPIs, as we often abbreviate ourselves, or sometimes APIs. The Asian American Pacific Islander Health Forum has worked on HIV issues for 25 years, conducting capacity building for HIV organizations serving all communities. I want to take some time to give some context for understanding the current state of HIV among AA and NHPIs, and then outline what I see as a challenge. HIV among our communities is in fact rising. Between 2010 and 2014, the Asian population in the United States grew at about 11%, more than 3 times as fast as the total US population. During the same period, the number of Asian Americans receiving an HIV diagnosis increased over 3 times as much, by 36%. This increase is driven by HIV diagnoses mostly among Asian American gay and bisexual men, whose HIV testing rates rose 101% between 2005 and 2011. Among Asian Americans, gay and bisexual men are most affected by HIV, accounting for 89% of all HIV diagnoses. among Asian Americans in 2015. In fact, the only United States racial ethnic groups that saw increases in HIV diagnoses during the period of 2010 to 2014 were Asian American, Native Hawaiian, and Pacific Islanders. Low HIV testing rates continue to be a big challenge. 66.5% of Asian Americans have never ever received an HIV test. And approximately 1 in 5, or 20% of Asian Americans living with HIV in the United States do not know that they have it. So coupled with the increases, this may mask the true extent of HIV in the Asian American population. Next slide. So let's talk about Native Hawaiian and Pacific Islanders, often abbreviated as NHPIs. In 2016, NHPIs made up only 0.2% of the entire US population. And correspondingly, NHPIs account for a relatively small percentage of new HIV diagnoses in the United States. But we need to realize that HIV affects these communities in ways that are not always apparent because of their small population sizes. From 2011 to 2015, HIV diagnoses increased approximately 50% among NHPIs. Similar to Asian Americans, among NHPIs, gay and bisexual men are the most affected by HIV, accounting for 90% of all HIV diagnoses among NHPIs in 2015. Low HIV testing rates are also a big challenge among NHPIs. 43.1% of NHPIs have never received an HIV test. In fact, AA and NHPIs together have the lowest testing rates among any United States racial ethnic group. Among NHPIs living with HIV in 2014, only 60% had received HIV medical care, only 43% were retained in HIV care, and just 50% had a suppressed viral load. These statistics are woefully out of sync with our national HIV/AIDS strategy goals. Next slide, please. So we've talked about gay and bisexual NHPIs and HIV already. Let's spend a moment to mention HIV testing and transgender NHPIs, who will also be discussed later in the presentation. Transgender AA and NHPI individuals have the lowest testing rate among all racial ethnic groups, 49% of ever being tested for HIV. By comparison, about 55% of transgender individuals have been tested for HIV, according to the 2015 US Transgender Survey. Next slide. So I've been doing this work for about 28 years, and as the statistics suggest, HIV is not getting better for AA and NHPI communities in the United States. Troublingly, it's getting worse. Recently, someone asked me what the major HIV challenge was facing NHPIs, and my answer has to be neglect. Funders and policymakers continue to fail to see and address HIV as a serious issue in our communities. Those of us doing the work continue to encounter and push back on a persistent model minority myth that says that our communities are higher educated, higher income, and therefore lower risk for HIV. One consequence of walking around and believing this is that funders and policymakers regard and treat all AA and NHPIs as if we're all alike and experience health and healthcare access the same. But when we disaggregate data and look at AA and NHPI specific ethnic groups, which my organization's research shows is neither uniformly nor consistently done here in the US, we can clearly see HIV disparities and barriers to health justice. Research has also shown that demographic misclassification of AA and NHPIs by providers constitutes a key limit in relying on existing data. So when I cite neglect, I include funder and policymaker assumptions that health needs and HIV risk for AA and NHPIs comprised of more than 40 diverse ethnic groups with distinct migration histories and community resources are all the same. This alarmingly results in less attention and resources to address HIV for those of us who have high risk for HIV, especially those who really need linguistic and culturally appropriate prevention and care. Unfortunately, this neglect has only worsened in the past decade, while the number of HIV diagnoses among AA and NHPIs in the United States has increased, as I've described. I have a colleague who 10 years ago called AA and NHPI HIV programs an endangered species. He recalls a time when they numbered 65, probably their highest. Now I think about those days and they seem rich in comparison. We had a network of AA and NHPI HIV programs coordinating and working nationally. Today, the federal government directly funds only one organization specifically working on HIV issues in AA and NHPI communities. And there are certain parts of the country where HIV rates are deemed not high enough, Hawaii, for example, that have been outright excluded from funding opportunities. So one can selectively talk about low numbers and low HIV prevalence among AA and NHPI communities to justify this. As AA and NHPI HIV advocates, we counter, as we have for the past 20 years, that stigma, linguistic barriers, and data collection practices make for an incomplete data picture of our communities. Given the increasing trends I've shared, this constitutes a form of neglect. Listen, we've made great strides in addressing HIV in the United States over the past decade. Today's HIV testing technology advances, treatment as prevention, and PrEP have made huge improvements. That cannot be argued. I think what I and my colleagues are arguing today is that something fundamental has to shift to ensure our AA and NHPI communities are included in this progress. And today, the prognosis is not good. That isn't equitable, and that isn't right. My other colleagues today will now speak about what they are doing in their communities about HIV. Thank you.
Thank you, Jacob. Next up, we have Brian Ragas, who's Communications Manager at the San Francisco Community Health Center.
Thank you, Jacob. That was really wonderful for setting the context of what's really happening in our communities. So what I'm about to address today is what we're doing here at the San Francisco Community Health Center and how we're really supporting national efforts to really bring awareness to the epidemic, to the HIV epidemic in API communities. One primarily through National Asian and Pacific Islander HIV Awareness Day, which has just happened in May 19th, and through our campaign, our current campaign, Love and Solidarity, Together PrEP, Testing, and Treatment Can End HIV. Next, please. Yes, I'm from the San Francisco Community Health Center, located here in San Francisco. Please check out our website, sfcommunityhealth.org. Next, please. And so I would just like to say we also just celebrated our 30-year anniversary. Formerly API Wellness, we just rebranded and transitioned our services to, historically we've been working in API communities for the past 30 years, and to which we actually started celebrating, commemorating National HIV API Awareness Day in 2005. But this transition marks a really bold movement of ours to really be really inclusive in the San Francisco area, with, of course, San Francisco being a very much an API city and also serving much more within our communities here. So we have a wonderful video on our website, so please check that out. Yeah, it's a great story for our transition. Next, please. And so what I really wanted to talk about again is through our project, the Banyan Tree Project, which we started in 2011, is a social media campaign to really, again, to concretely address HIV in API communities, specifically by tackling social stigma that APIs really get from in our communities around testing, around treatment, about talking about sex in general and in HIV. And so since this project launched, we had a number of different variations on this campaign through digital stories that we create, and posters, and supporting other national efforts on the ground to really hold their own HIV Awareness Day events. So particularly with this campaign toolkit, we also developed a campaign toolkit that helps support these events and other national events around the nation. Next, please. So this year's campaign, again, is what we call Love and Solidarity. Together, PrEP, Testing, and Treatment Can End HIV. Again, we came up with this again as marking the three strongest tools, again, to combat HIV in API communities. And so with this campaign, we also developed similar gathered national data that Jacob was talking about, and really putting them into toolkits and handouts that we make available to the community, one online that you can easily download, but as well as through our events that we hold here in San Francisco and nationally as well. One specifically, again, correlating data from HIV and API communities. We also have a PrEP fact sheet that we also developed, again, talking about what PrEP is, the benefits of PrEP, how PrEP is being used in API communities, and if it actually works with that individual. We also developed a stigma and HIV and AIDS in Asian Pacific Islanders fact sheet as well too. So these are more narrative stories about folks who experience, again, the different aspects of HIV, again, from testing to being positive and disclosure and things like that. So again, they're on our website, the Banyan Tree Project, and they're all available for download. Again, we're also working on a new digital story that we're also working to create, and that should be debuted near our SF Pride, actually, around the late end of June. So also keep an eye out for that for one of our newest digital stories, again, to continue on this discussion with about HIV and API communities. So keep an eye out for that. Next, please. Oh, and that's it for me.
Thank you, Brian. Next up, we have Henry Ocampo from the Office of Minority Health Resource Center.
Hello, everyone. My name is Henry Ocampo from the Office of Minority Health Resource Center. I'm here today to share with you our Asian American, Native Hawaiian, Pacific Islander project. Next slide, please. The mission of the Office of Minority Health within the U.S. Department of Health and Human Services is to improve the health of racial and ethnic minority populations through the development of health policies and programs that will help eliminate health disparities. Next slide, please. Next slide, please. Thank you. As Jacob mentioned earlier, this project was a response to the lack of federal funding targeting HIV/AIDS amongst the AA and NHPI communities. We were able to secure a 2-year funding from the Secretary's Minority AIDS Initiative funds administered by the Office of HIV/AIDS and Infectious Disease Policy. Fortunately, this project will end this September 2018. The goal of this project is to increase utilization of HIV testing and linkage services among AA and NHPIs through coordinated media and community events, which promote awareness of HIV/AIDS through 4 separate tasks. Next slide, please. The San Francisco Community Health Center, what Brian mentioned is from earlier, formerly the Asian Pacific Islander Wellness Center, was funded to coordinate the National API HIV Awareness Day on May 19th. The San Francisco Community Health Center created and maintains a national social marketing campaign, the Banyan Tree Project, to eliminate HIV stigma in AA and NHPI communities. This campaign includes a website, PSAs, print advertising, digital stories with affected AA and NHPI community members, social media promotion, as well as community engagement support kits. Next slide, please. Also through this project, we were able to fund 11 agencies around the country to implement an HIV/AIDS health information campaign with the goal of increased awareness of HIV/AIDS and increased HIV testing with referral to care of Asian Americans, Native Hawaiians, and Pacific Islanders. The health information campaigns are dispersed throughout the U.S. and U.S. territories, including 1 in Hawaii, 3 in the U.S. Pacific Island jurisdictions, and 7 within the continental U.S. These campaigns target various subpopulations, such as Hawaiians, South Asians in New Jersey, Vietnamese in San Jose, California, the Hmong community in Butte County, Pacific Islander college students throughout Micronesia, and the AA and NHPI LGBTQ organizations around the country. Next slide, please. Next slide.
So Henry, we have a slow slide. Just a second, please.
Okay.
Muted.
Okay, great. So here's some highlights of the HIV information campaigns developed by the 11 funded agencies. For example, the Asian Americans for Community Involvement launched their Healthy Life, Healthy Living campaign, promoting HIV testing for Vietnamese community in San Jose, California. The bottom left image is one of their materials, which launched 5 billboards, 45 bus ads with 5 different HIV education anti-stigma messages. The Eric B. Chandler Health Center is producing 12 radio shows targeting South Asians in New Jersey. Each show includes a true story of a person living with HIV, recorded by a voice actor. Following the story, the radio host interviews a physician about topics that were brought up in the story. One show featured a bilingual physician who discussed the topics in both English and Hindi. Some of the issues addressed in these radio shows include HIV risk factors, difference between HIV/AIDS, free HIV testing resources, mental health, HIV medications, stigma. The Gala Guam in the far right developed a 60-second commercial titled "Take Control of Your Health." The commercial was aired on 17 movie screens for 2 months with a viewership totaling over 77,000. The commercial was also aired on flat screen monitors in the local mall food courts for about 2 months with viewership reaching over 240,000. The National Queer Pacific Islander Alliance has been sharing HIV materials to their network of over 40 AA and NHPI LGBTQ organizations throughout the country. They've also incorporated HIV prevention education in their regional and national gatherings. More importantly, through these local campaigns, we've been able to get about roughly, so far, 2,380 people tested for HIV with 25 positive results. Next slide, please. We've also collaborated with the University of Guam to develop a 10-lesson culturally relevant curriculum on HIV/AIDS in Micronesia. In addition, this curriculum also incorporates general well-being lessons around the topic of family violence, drug and alcohol use, suicide prevention, and working together for a better community. This curriculum is titled Navigating Personal Well-Being and Sexuality to Chukis and Chamorros. This manual was developed to help peer educators, teachers, counselors, social workers, community and traditional leaders, and health advocates. This curriculum was published last year, 2017, through the University of Guam Press. We conducted 2 series of training of trainers on the use of this curriculum in Guam and in Chuuk State, Federated States of Micronesia. So far, a total of 71 individuals participated in the 5 training of trainers, representing Department of Public Health, Behavioral Health, Department of Education, community organizations, community leaders, peer advocates, and even Attorney General Office. We're working with the University of Guam to have this curriculum incorporated within the local Department of Education. Next slide. We've also been supporting building the capacity of the Pacific to address HIV/AIDS. We've partnered with the University of Hawaii AIDS Education Training Center to host HIV clinical trainings for medical providers, nurses, and lab techs that increases HIV care and treatment knowledge. These trainings are critical to ensure that patients living with HIV in the Pacific region receive the best and current HIV medical treatment. A total of 82 medical providers in community health centers and private clinics participated in 3 HIV clinical trainings this past year. We've also collaborated with CDC in providing HIV and Hep C outreach testing and linkage trainings in the Pacific. Peter Silva from the Hawaii Department of Health, along with Konane Dreyer and Kathy Kapua from the Life Foundation, trained 99 individuals on HIV testing and linkage in the Marshall Islands, Saipan, and Guam. Finally, we've also supported the Life Group Los Angeles to conduct the training of trainers of its evidence-based Pause Life curriculum, training HIV providers and affected community members to become peer facilitators in the state of Hawaii. The 20-hour in-person Pause Life weekend seminar is a peer facilitated based model that removes the barriers between clients and providers and helps empower clients to make more informed decisions in their HIV care, conducted over the course of 3 days. A total of 54 HIV providers and people living with HIV/AIDS were trained on the Pause Life curriculum to serve as peer facilitators in their respective island communities in Hawaii. Next slide. Thank you so much.
Thank you, Henry. And I want to give a quick shout out to Henry for all his hard work in pulling all of our presenters together today. Thank you very much. We appreciate it. Our next speaker is Jimmy Sianipar.
Hey everybody, I'm going to be talking about our campaign called Status is Sexy. We named it Status is Sexy because we wanted to create conversation around HIV testing. You know, when people see something like Status is Sexy, you know, people always come up to us, they're like, Status is Sexy, what does that mean? You know, and then that's where we create a conversation and talk about what HIV testing means for our community. Next slide. Okay, the campaign is to reduce stigma. The aim for the campaign is to create conversations about why API individuals are so afraid to get HIV testing. So, you know, we want to just be able to have more sex-positive conversations about topics such as masturbation, sexual habits, you know, types of relationships outside of monogamous relationships, and, you know, just be able to talk about why exactly we're afraid of getting tested and talk about the shame and stigma that involves it. And also it aims to have relatable images of community influencers who aren't afraid to get tested. Also shows that getting HIV tested is a form of strength and that even community influencers had the same scared reactions during the first HIV test. So we had a range of people in the community, whether it's from the entertainment community, from the adult film industry, or even from the social justice community, just them giving their honest truths about why they are or they aren't afraid of getting HIV tests, and just showing that, you know, it's a normal thing that everyone goes through. And it's also emphasized the fight against HIV is not over for the API population. And being able to talk about this campaign with people, you know, we're encountering API individuals who still think that HIV doesn't affect Asians. So next slide.
Muted.
One second, Jimmy. We have a slow slide.
Okay. All right. So our tagline is "Find Your Strength, Challenge the Stigma," and here's a picture of our youth advisory board, and they've been great because they've been giving us input on how to reach the 18 to 24 or 16 to 24 communities, and you know, with all the different trends that's happening at all times, we need to know what's going on in the community. Next slide. Okay, and this, as an actress, her name is Nikki Suhu. So she's been in films such as The Lovely Bones and some other TV shows on ABC. And in here, she's showing what her other talent is, which is like fitness and working out, and just showing that a lot of imagery when it comes to HIV testing, it doesn't have to be so literal. You know, it can be, you know, about finding your inner strength and what you believe in your passion, and how you could incorporate that with HIV messaging. All right, next slide. Okay, and this is the
Muted.
on our website, and then in the main page we have a person who we call kind of like a popular opinion leader in the community. So his name is Derek, and we decided to pick Derek as kind of a face for our campaign because Derek knows a lot of people in the community. If you go out to the gay, Asian, API, Hawaiian communities, a lot of people know Derek, even people from like, you know, out of state know Derek. And then, you know, it's so important to find these leaders, you know, to show up for the cause and talk about why they get HIV testing. Next slide.
One second, Jimmy. We have a slow slide again. Our apologies, everyone. We sometimes have slow internet connections, so sometimes this happens. Our apologies.
All right, so this is all of our kind of community influencers. You know, they have actresses like Kelly Hu, Alex Mapa, who's been in Ugly Betty, Jake Shore, who's been in some gay Asian films called Front Cover, and we also have Yasmin Lee, who's been in The Hangover, and she also works in the adult film industry. So we're getting a lot of a variety of people just to talk about why they're not afraid to get tested. And what's really surprising is, for an adult film star like Yasmin Lee to talk about why she's actually still afraid to get tested and why she goes and gets tested anyway is it's a very powerful conversation. While it might be scary, but for peace of mind, what are the reasons why you do it? Next slide. All right, and this person here is Calvin. So he event organizes for one of the biggest gay API events in LA called Game Boy. And I would call him more like a gatekeeper for the community because, he's seen what's been going on out in the clubs. He knows how to reach the community. He knows how to get them to come in. And from there, we've been able to outreach at the clubs and bringing the Status Sexy campaign to, the audience that needs it the most. Next slide. Okay, and then for the next 3 slides, we have just kind of stills from the videos that we release. We also release kind of like PSA videos where we ask everyone questions about who they are, what are their fears, why they get HIV testing, and we want it to be very, very honest answers. I think when it comes to media campaigns, social media campaigns, I think honesty is the best way to communicate because nowadays, with the age of influencers and everyone selling you something, we want really honest messaging. Okay, so next slide. Okay, so here's another still from the video with Alex Mapa. Next slide. Okay, and then we also give a video with the Youth Advisory Board giving stats about about youth HIV testing and specifically API testing. Next slide. All right, so on top of doing a lot of digital marketing, we're bringing the campaign outside. So this is us doing outreach at the train station nearby. And here we're giving out condoms, and we're also making appointments for people to come in and get tested. And so, we want to bring this campaign out, make a call to action to make the appointment online and just come in. Next slide. And we also incorporate it in Pride events. So last year we hosted the first ever Venice Pride. We called it the Status is Sexy Pride. And we were able to, have a big event with dancers and performers and just spreading the word and just showing how, visibility is so important. If you want the community to know who you are, you need to be out there, just, showing the images. And we also had giveaways where we give out bags with Status is Sexy branding and being able to talk to people about what it means. Next slide. All right, and then we also incorporated archival footage in our campaign. So this is a campaign image from the 90s, and just showing how powerful it is even today and how relevant it is. And, just having an image that says, love your Asian body. And it's just, for today it might be like a shocking campaign, but for back then it wasn't. And so, you know, we want to go back to our roots and talk about these types of campaigns. Next slide. All right, and then to end it, so why this campaign is important? There's no national campaign focusing specifically on API populations with HIV. You know, a lot of the national ads that we see out there aren't really representative of us. And it creates this identity and awareness for the agency beyond the organization name. And so, you know, my organization is called APAIT, or Asian Pacific AIDS Intervention Team. But the Status of Sexy campaign, it's an offshoot kind of campaign just to highlight our testing program specifically. And I know a lot of our programs now focus on the beyond API population. So, you know, it creates a specific focus. And lets the public know that the current agency is in today's world of social media and 24/7 marketing. You know, we want to be in the know. We want people to know that we know what's going on in the communities and why, you know, specific matters or why people are, for example, heavier meth use and being more culturally competent about these things. And then also, you know, it just creates, we have so little representation anyway in the media. You know, we have to create our thoughts, especially for something in the HIV/AIDS sphere. Okay, and then it gets more people to make appointments without shame. You know, getting people to just go to the website, make an appointment, just show up the next day without having to talk to anyone. You know, and that's really important. And you know, and that's why, you know, we think statussexy.com has been super successful for us. And that's it.
Okay, thank you, Jimmy. Thank you so much, and apologies again for the
Muted.
times. Our next speaker is Keiva-Lei Candena. Keiva-Lei, it's all yours. Sorry, Keiva-Lei, are you there?
Hi, I'm here.
Okay, go right ahead.
Aloha, this is Keiva-Lei Candena. I'm the communications manager here at Life Foundation. We're here to talk to you about the POP Ohana, which is our project on cultivating leadership across the state of Hawaii. Next slide, please. So before we get into the actual program, the POP program that we're going to be talking about, we wanted to share some information about our agency. Life Foundation has been open for the past 35 years in providing HIV services across the state and across the Pacific in capacity building. And we are partnering up with the Community Health Outreach Workers Project, the CHOW Project, which is our local needle exchange program. And they also do housing case manager with a focus on hepatitis C. And so in the last year or so, we've been in the middle of a merge, and we're just in the final stages of that merge. And as of July 1st, we will be known as the Hawaii Health and Harm Reduction Center. It's a new chapter for both of our agencies, and we're looking forward to the growth and the opportunity to reach out to more Native Hawaiians and Asian Pacific Islanders and different demographics, not only focused on HIV, but also the other disparities in health that there might be. So we're excited to share that information. We'll be known as H3RC. Next slide, please. So the POP Ohana is a project that was, brought to us from a grant from AIDS United. It is a positive organizing project, and it was our opportunity to create some leadership across the state. There was little activity and little participation from people living with HIV and actually bringing services and programs to our communities. And so we wanted to create an opportunity and a network for them to be able to come together, build their skills on advocacy, policy, programs, and prevention. We named it the Ohana because in Native Hawaiian terms, Ohana has much more meaning than just the word family. It actually is kind of an extended family. It doesn't have to be blood related, and it really is talking about the connection that people have and their commonalities, not just in blood, but in lifestyles, in life choices, and in life experiences. And so we wanted to make sure that we brought in that Native Hawaiian term in order to get everyone on the idea that this is more than just a project or a program. It is a network of people that would be supporting each other. Next slide, please. So our objectives with this POP Ohana, and the reason why we had brought this to fruition, was we really wanted to address the stigma about HIV within the Native Hawaiian and Asian Pacific Islanders community, especially here in Hawaii. We all know that it's not talked about very much in the family network at home, and even in the LGBT communities. It's a difficult conversation to have, and so we wanted to give the opportunity to people living with HIV to really kind of take ownership of their lives and take ownership of their HIV status, and we wanted to do that by coming together and just building up their capacity on the services and programs and how to be leaders in their community. So we created this Ohana, and we wanted to make it a place where individuals can find education and support, and especially empowerment. We felt that that empowerment would erase that internal stigma that our HIV positive community might have, and in turn help them take some ownership of the programs and services that we offer here in Hawaii. So we wanted to encourage that leadership and advocacy by really explaining to them what we felt meaningful involvement was for people living with HIV, and how that really circles around policy making and decision making when it comes to the services and programs. And so that was our goals for this POP Ohana, and I think that we did a very good job about meeting those goals. Next slide, please. And so how did we do it? We put together 3 seminars over a span of 1 month, and we had recruiters from different parts of the state. We used our collaborations and our friendships with the other AIDS service organizations on the other islands, Hawaii Island HIV and AIDS Foundation on the Big Island. We use Maui AIDS Foundation on Maui and Malamapono Health Services on Kauai. We utilized their connection with us to recruit out to other people living with HIV in their areas. We invited them to come to Honolulu for 3 different sessions to complete this POP seminar. The first day of that session was focusing pretty much on the person itself, explaining what MIPA was, the meaningful involvement of people living with HIV, really encourage advocacy and how that looks, really addressing our language and how we refer to HIV in modern times. And we wanted to make sure that we were able to build the individual's capacity on how to have conversations and really what it takes to be a leader in our community. The second day was really focused on programs and services that we have here in Hawaii. We wanted to give overviews of each different agency and each different program, and especially the Ryan White program, so that our POP Ohana members could have a better idea of what those services look like. And so when they needed to have those conversations with other people across the state, they were able to do that with the knowledge that they gained in this seminar. The third day was really recapping the 2 different days and also inviting the Department of Health in to explain the process of funding in our state. Hawaii is a low-number state, so we don't get CDC direct funding, as many Asian Pacific Islander agencies have that challenge. But so we rely on the Department of Health to bring a lot of programs and services. And so we wanted to have their staff come in and really talk about the different things that they bring and the way that funding gets funneled down to our agencies and to our services and programs. So we were very fortunate to have the buy-in from all of them. And they came in and explained each aspect of the harm reduction in HIV and AIDS branch from our own Department of Health in the state of Hawaii. So we were lucky to have them. It was a really, really successful 3 days. We finished that up with 21 graduates of our POP Ohana, and they still continue to advocate and to participate and volunteer in their collective communities across the state. And so we're really proud of that. Next slide, please. The whole purpose of our POP Ohana, and we continue to stress this purpose, is it reduces the stigma from the inside and out. Really, internal stigma is what we can perpetuate, and when we kind of create role models of health and wellness and people living and thriving with HIV, it really takes the stigma out of the community of what HIV looks like today in 2018. And so we felt that that would be a really key model in promoting testing and linkage to care, and educating the Native Hawaiian and Asian Pacific Islanders community about the modernized HIV. Next slide, please. So one of our success stories from the POP Ohana is Keleka, and she's here to tell her story and her experience as a POP Ohana member and what she's doing now after she's gone through those trainings and sessions. So please welcome Keleka.
Hello, hi everybody, can you hear me? Okay, good morning everybody. So my name is Keleka Kaneiakala, and I am one of the POP Ohana leadership. And so before I get into the
Muted.
I just want to kind of give you like a little brief background about myself. I was tested positive in September 26, 2008. I've been living with HIV for about 10 years, which pretty much started this destiny and this journey that I'm totally on fire for. So basically, when I had tested positive, I had some difficult issues, just like most and some. And so what had happened was I had sought services with Life Foundation, and altogether, I guess like how Keiva had talked about that internal stigma, I lived with this stigma and I was afraid to do anything with myself or with anybody else. So we're just going to continue to exist in life. And eventually I had met a really good outreach worker that worked for the Life Foundation that was able to help me to get me to the next step and get me situated and stable. And from that point on, it kind of opened up doors for me to move in a more progressive and positive direction. And so what happened was they had invited me to the POP Ohana leadership, which had taken place last year. And it was a 3-day seminar. And it gave me the opportunity to see what actually goes on with the services that our health providers actually provide for us. Like Keiva had touched upon, like what Ryan White actually does. So it had given me the knowledge, and I think the really big part that really touched me was the MIPA portion, which was that meaningful involvement, because I realized that on my journey and how I got to that point, to that leadership training, that I was a difficult role. I did come from a substance abuse and homeless background. I am Native Hawaiian. I'm a Native Hawaiian transgender, living with HIV, and I really wanted to make sure that the next person didn't fall through the cracks. So this leadership was exactly where I needed to be. And so as we continued to participate and learned about what POP Ohana had to give us, I completed the 3-day session and was able to move on to actually this year, which I'm actually a leader, and I'm actually presenting to our new POP Ohana leaders for this year. So we had the opportunity of flying from the neighbor islands. We have done Maui and Kauai so far. We'll be moving on to the Big Island, and my portion of it is on that meaningful involvement. And how important that meaningful involvement is, how important is that voice, and how it makes a difference coming from that person living with HIV, and how we can work together with our allies, with our service providers, in order to make to create the programs and services that we truly need. We have a lot of people living with HIV because of modern medicine. They live a lot longer. So what kind of services do they need? If you ask me and when it comes to stigma, let's talk about stigma. Like I said, I had that internal stigma. By doing participating in this POP leadership, I am able to diffuse that stigma within myself. That I can, that as I continue to move on and educate everyone, I've been able to empower them and encourage them, and to help reduce that stigma by being a role model that, hey, I'm living with HIV and I'm okay with it. And and someday that person will get to that place too. But what I do as an advocate, what I do as a leader, what I do as an example is continue to make that water available for that time when they are ready to drink. And when they are ready to drink, that water will be available for them. So that's all I could do. And if you ask me how POP Ohana works, if this leadership program works, I definitely would say it works. I'm a living example. It's helped me to move to bigger and better things. What I was able to participate in the Positive Women's, our Speak Up for Positive Women's Network. I was able to participate in a digital storytelling. All those things would have been made possible if we weren't able to reduce that stigma. So I just want to thank everybody for allowing me to speak on our behalf of our POP leadership, allowing me to share with you guys. Thank you and mahalo.
Thank you so much, Keleka. Next slide, please. And let me just add that, Keleka has been a huge success. And she failed to mention, but she's actually going to be starting working as an outreach worker in the next couple of weeks, as soon as I let her go from all of these presentations I'm letting her do. I'm making her do. So she's actually found gainful employment, and she gets to be that role model of a successful person living with HIV out in the streets doing outreach. So we're very proud of her and all the work that she continues to do as a POP leader. And that's our presentation. Thank you very much.
Thank you, and thank you so much for joining us first thing in the.
Yeah,
Hey.
Sorry.
Thank you, and thank you for joining us so early in the morning in Hawaii. We appreciate you. Okay, thank you for joining us from Hawaii. So first thing in the morning, we greatly appreciate it out there. So now we have a few minutes for questions. Again, if you'd like to ask questions, you can enter them in the chat box, or you can raise your hand there in the attendees list and let us know if you have a question. While you're thinking about questions, we have a couple of evaluation polls we want to run for you. So we'll launch the first one now, and we'll give you a couple of minutes to answer that one. Again, this helps us in the future as we are planning out more webinars, help us get the word out, the best way to get the word out. So we really appreciate your participating in these polls. Give it a few more seconds here. And all right. Again, if you have any questions, please let us know in the chat or by raising your hand. Let's run the second poll now. For a second. Okay.
Muted.
Okay, we have one question in the chat box from Alicia. Thank you to everyone for all the wonderful work that you are doing. As someone who is white, how can I best be a support to Asians, Native Hawaiians, and Pacific Islanders? Who wants to take a shot at that one? Okay. Keiva-Lei, you should be good. You should be good to answer.
Okay, so when it comes to stigma, you know, the Native Hawaiian Asian Pacific Islander, yes, we deal with a lot of stigma. It's cultural. It has a lot to do with our family upbringing and keeping things personal and private, and definitely not talking about things openly like sex. And I think one of my colleagues made mention of that earlier. You know, it's a difficult conversation to have, and the concept of bringing shame to your family is very real when it comes to Asian Pacific Islander cultural values. What I think that we can do as providers and as allies to the Native Hawaiian and Asian Pacific Islander community is really, really thinking of different ways to reduce the stigma. For example, here in our office, we've been making a lot of changes because of the merger. And for the last, I think, 20 years, we've had a separate waiting room for our HIV positive clients to protect their confidentiality when they're coming in to see their case manager or coming in for services or programs or the support group or whatnot. And as a woman living with HIV, I never really, as an empowered woman living with HIV, there's a difference. After being empowered and finding a voice in leadership, I didn't like that private room. I thought that it was perpetuating a stigma. It was telling our HIV positive clients that we need to keep you a secret, that we're going to protect you, that we're going to hide you over here in the corner. And I really felt like that it wasn't doing our agency and our clients any good by kind of perpetuating that idea that they needed some kind of protection when they were here for health and wellness. And so we've recently just taken away that private waiting room and we've opened it up, and HIV status does not need to be discussed in the public forum if that person doesn't choose to. But as a HIV and AIDS service organization, we also don't need to feel like we need to protect them from themselves or protect them from the community. If someone comes here, they can be coming here for any of different reasons, whether it's about HIV or whether it's about wanting services or whether it's about LGBT issues. And so I'm really proud that we kind of addressed that perpetuating stigma in our own agency. And so I encourage folks to really think about how their agency or their community might be perpetuating a stigma by, say, protecting the word HIV or not speaking the word HIV in conversations when it comes to being tested or knowing your status or getting engaged in linkage. Those are the kind of things that I think that we can do, really looking at our language and how we speak about it and how we almost protect that word, if you will. That's my thoughts on it. Thank you.
Thank you. Looks like we have a couple more questions coming in. I know John Moses sent in a chat question, but I think we've answered that in the chat about programming at USC. We have a couple folks have their hands raised. Kekoa, your question, please.
Hi, can you hear me?
Yes, we can hear you.
Okay, awesome. Hi, I'm Kekoa from the Hawaii Island HIV/AIDS Foundation. Thank you so much, Keiva and Keleka, for sharing, and for everybody else who's been presenting. This question is more for Keiva and Keleka. I'm wondering if you folks would be able to tell me if the different stigma that exists or persists in each different island community is different from one another, or if you've seen that they are kind of the same throughout the state.
One minute, please. We're unmuting her line. We're unmuting their line.
So, Koa, you know, luckily, both Keleka and I have both been traveling the islands over the last month. for the second year of this POP training. And yeah, I do think it's different. And I don't think it's, I don't think the main factor is the local area. I really think the main factor is people living with HIV really being at different stages of their life. You know, we have a lot of long-term survivors here in Hawaii. People come here to retire, people come here to get healthy or to relax and get away from, you know, whatever life that they were living before. And so there's a lot of people 20 plus years living with HIV on the outer islands as well. And I think that sometimes it's the, dare I say, the old ideals of what HIV used to be before things like U equals U, or before things like PrEP. And so I think that having that opportunity to really educate them on modernized HIV has helped that a lot. But yes, when it comes to outer islands as well, it's difficult because it's such a small community. I think on the island of Kauai, there's about 36 people living with HIV. Don't quote me on like 36 to 50. And so when it's that small of a community, it's definitely, I mean, even for me, it would be nerve-wracking to, you know, to navigate through my community when, you know, everywhere you go, someone's going to know your status. And so it can be a little bit difficult when it's such a small community like that, and small island populations like Kauai and Maui and Kona, where you are, Nahe. Thank you for that question.
Thank you. Our next person is Sheena Dance. And Sheena, can you hear us? Sorry, Sheena, we can't hear you. Are you asking your question? Sorry, Sheena? Sheena, have you muted your line? Because we cannot hear you. Okay, Sheena has asked her question in the chat box. She wants to know why this is not a national issue. Which presenter would like to tackle that one? And you can let us know in the chat box which of you would like to. Looks like Keiva-Lei, would you like to take that one?
I feel bad I'm taking all the questions. But
that's quite all right, don't worry.
Really, it is a national issue, Sheena. It's you know, stigma is dealt with all over the country. The Native Hawaiian Asian Pacific Islander community is just a little bit more stigmatized because we're such a small group. And so when we, and culturally, it is what it is culturally. It's difficult to be heard on the national level when our numbers compared to other populations that are living with HIV or that are at risk for HIV are so high. And ours are in say, the views of CDC or other funders are not so high. We know, especially like in Hawaii, where, you know, the majority of the population is Native Hawaiian and Pacific Islander. It's a factor that we have to pay attention to. We're forced to because it's our community. But on a national level, you know, there's different opportunities to make these things known. The Positive Women's Network is one of them. The U.S. People Living with HIV Caucus is another. The AIDS Watch, where we get to talk to our local representatives in Washington, D.C. And advocate about services and issues that are important to us. These are all platforms that to kind of make these issues and these difficulties known to us. So, and that's why we're sharing them with all you folks, because now we get to all be the voice.
Great, thank you. Jacob, I saw you had your hand up. Did you have something you wanted to add?
Yeah, I think that was a great summary about why it isn't a national issue. You know, I think groups like the Health Forum try to bring up issues when they present nationally, when there's an opportunity to talk about HIV on a national platform. But because of the resources and sort of the prioritization of resources, we haven't come out with resources that really sort of fund work in the NHPI community. So I think that's fundamentally the problem. Scarce resources is nothing new to all the communities affected by HIV, and I think you know, it's just an ongoing, long-term struggle to bring the issue to the forefront over and over again, and make our voices heard.
Thank you, Jacob. Sheena, I see you still have your hand up. Did you have a follow-up question? No, Sheena, do you have a follow-up question at all? Okay, thank you. Well, since we have no further questions, let's move on to the next slide, the final slide. Thank you, everyone, for being here today. Please fill out the evaluation form that should launch automatically once you leave the webinar. Our next webinar will be June 20th on transgender Americans. You can find more information about our upcoming webinars on our website, nmac.org/webinars. Thank you so much to all of our presenters who joined us today, and thank you to everyone who joined us for what we think was a really great presentation. And we hope to see many of you, if not all of you, again for our next webinar in June. Thank you so much.